Cluster headache. Headache can be one of the symptoms of many diseases. So, headache, there are so many different types of headache and so many different diseases which presents as headache. And out of that, I am choosing one type which is cluster headache, and we are going to discuss about it. So, any patient who suffers from cluster headache, he gives the following characteristics. He says that the patient says the headache which is one side, unilateral, it's severe type of headache. It's so severe that it is equivalent to a red hot rod or a poker is pierced into the head of one side. It's so severe pain. And this usually lasts for 15 seconds and maximum of 3 hours. And it usually repeats 3 or 4 bouts of attack per day. And sometimes what happens is the patient who goes to sleep, he is awakened from the sleep because of the headache. And the unique thing about that is, this headache is, this bouts of attack or episode, it is repeated the next day at the same time. Say suppose 4 o'clock today, maybe he'll get the same episode next day also. So per day he gets 3 or 4 episodes. And I'll tell you about the periodicity also. Before that, along with the headache, when we ask a few questions to the patient, the answer to all these questions will be yes. One, when you ask him, at the time of headache, do you have redness of the eye? He'll say yes. So maybe somebody has told him. And when you say, is it watering from that one side, that particular side? He says yes. And that particular side, nasal cavity, there's watery rhinorrhea, watery discharge. He says yes. Has anybody told you that type of headache, there is flushing of the face of that particular side? He says yes. So along with the headache, he will get all these complaints, which is specific for this condition. Now, there is one more thing. If the patient happens to be an alcoholic, he says when he takes alcohol, an episode or a bout of attack is precipitated. That gives us a hint. Now, with this, when you get this hint, we have two medications. One is nitroglycerin, other one is histamine. If we can inject nitroglycerin and histamine, and if there is no contraindication for injecting the medicine for him, if we inject this medication, we can precipitate an attack. Why I am saying no contraindication? Because nitroglycerin is usually given for cardiac patients. Now, by the way, this cluster headache is more common between the age group of 20 to 50, and it has got a male preponderance. Now, we have come to when you give nitroglycerin and histamine, if it precipitates an headache, then we have a provisional diagnosis of cluster headache. On examination, now before going into examination, let me tell you about the periodicity. See, in this graph, if you see Monday to Thursday, Monday the patient has got 3 or 4 bouts of attack or episodes of headache. Likewise, Tuesday, maybe less than so, Wednesday, Thursday, and he gets the same thing the whole month, and after that he will be symptom free for a long period, for a few months. Then again, say about November or December, the whole thing gets repeated. So symptom free period in between. This is the periodicity profile of cluster headache. Now, on examination, when the patient doesn't have a headache episode, he will be completely normal. The examination findings will be negative. So the complaints, whatever he said, it's only during a headache episode. So investigation, I have told you a small procedure, nitroglycerin histamine to be injected so that we can precipitate an attack of headache. And we would like to do a CT scan and MRI to rule out whether he has got any other disease or not. Only for that, not for the diagnosis specific for cluster headache. Coming to treatment. So treatment we can divide into 3 parts. One is during an acute episode of headache. Second is prophylaxis. Third being surgery. So during an acute episode of headache, if in a hospital setup, we can give 100% oxygen, that is in 7 to 15 liters over a period of 20 minutes. This will abort an attack of headache. If the patient is not in the hospital and he is outside, if he takes any one of the triptan group of medicine like sumatriptan, rizatriptan or zolmitriptan, you can abort an attack. But these medications in India is costly, it's about 35 to 50 rupees per tablet, the cheaper one being ergotamine. But mind, all these medications, please do not get over the counter. This has to be prescribed by a doctor. The doctor will decide which medication, what dosage and which medication to be prescribed to which type of patients and what are the other comorbid condition he has got, because these medications got a lot of side effects and medication has to be titrated properly. The doctor will decide on that. So please do not get it over the counter. Now, talking about the preventive medicines, for prevention any of these medications can be given. Again, the same thing applies for these also. That is not to get it over the counter, because the first one is given for cardiac condition, the second one again is given for cardiac condition, and the third one is given mainly for, it is an anticonvulsant given for those patients who develop convulsions or fits. So this has got different effects and it's got a lot of side effects also. So we have to have a proper prescription from the doctor and you should know what dosage and how much long to give it and how much to titer. So please do not get it over the counter. Now coming to surgery. So the surgical procedure for this condition is very rare. It's not common at all. Why? Most of the patients we can manage medically. Suppose medically it's very severe, we are not able to manage medically and patient is not compliant with the medicine and we are not able to manage with the medicine, there's failed medication or he has got complications if he takes the medicine. In that case, we can give a trial run of surgery, the first one being surgery. And the second and the third one are non-invasive procedures and not a surgical, non-invasive procedure where we destroy the fifth cranial nerve. By the way, let me tell you what is happening in this condition. See, totally you have 12 cranial nerves. Out of that, the fifth cranial nerve is the trigeminal nerve. So what happens in cluster headache, why this cluster headache occurs is that because there are blood vessels around the fifth cranial nerve. So when there is sudden dilatation of the blood vessel, it pressurizes on the fifth cranial nerve. So on the distribution of that particular nerve, you have headache. Now why does it cause in that particular area and why does it occur in that particular time? Like suppose I get headache by 6 o'clock today, again it's getting repeated on the next day same time. The reason what they have proposed is that the main cause for that is the problem is in the brain. There's a particular area called hypothalamus in the brain. So in hypothalamus there is a circadian rhythm and because of a chemical change there is a blood vessel change or blood vessel dilatation in and around the trigeminal nerve. That is the reason for this. So what we are doing by surgical procedure or medical treatment is that, the trigeminal nerve, we are trying to destroy that nerve by doing any of these so that it doesn't conduct the pain. And for the medical treatment is that we are trying to decrease the threshold of the pain. That's how the medical treatment works. Now, the take-home message. Suppose the patient happened to be an alcoholic, please stop drinking alcohol. Second one is, other than the alcohol, maybe hot weather, climatic condition, hot weather condition, it's a sunny day, that can precipitate a headache. Even otherwise it can. So in the cluster headache also it can precipitate. And even a strenuous activity or exercise can also precipitate this type of cluster headache. So try to avoid all of these so that you don't get an episode of headache. So this is in short about cluster headache. Thank you so much.